All right. Good evening, everyone. Just going to give everyone a few minutes to sign in. And I know it can take a little time for sometimes our technology to work and for folks to get logged in, signed in. So we'll just wait a little bit before we officially get started. As folks are joining, if you would like to in the chat, I'd love to hear where you're joining us from. All right. If you're just joining us, I'm still just giving folks a few moments to log on and join the event if they're planning to. I'd ask anyone to, if you join in, to type in the chat where you're joining us from. If you're currently pregnant, you can also let us know how far along you are. But you don't have to be pregnant to join this event. And perhaps we may have some viewers who, are in the early stages of planning to conceive and just really wanting to get a head start on learning about planning for their birth. So that's okay also. All right. Maybe one more minute just to see if any other members or other viewers want to join in. And after that, we'll just get started. I see a couple more adding in. If you're just joining us, we're just giving everyone a few moments to log on. If you want to type in the chat where you're joining us from, and if you're currently pregnant, if you want to let us know how far along you are. All right. Well, I think it's 3 minutes after our start time. So in the interest of time, I will go ahead and get started. So good evening, everyone. My name is Jenna Beckham. My pronouns are she, her, and I am a board certified OBGYN with subspecialty board certification in complex family planning. I live in North Carolina and I work in North Carolina and in Virginia. And tonight we're going to be talking about planning for your birth or making a birth plan. So you'll see there in the chat, there is a poll. So you can let us know, do you currently have a birth plan? Just to see where folks are coming from. If you know a lot about it, or if you have one, or if this is all brand new to you. So far I see no's, so that's great. That means I have hopefully a lot to teach you. Before we get started, I'll just remind everyone or let you know if you aren't familiar with Twill Care, we are an app and a website where you can connect with others, share experiences, and get insights from experts like me. So after this session, I encourage you to join our supportive community if you haven't already. And if you have questions tonight during the event and I'm not able to answer them, then you can always come to the Twill community and either myself or one of our other experts will be sure to answer your questions. And next, before we get started, I'll just a reminder that this event is meant to be a helpful resource. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. So without further ado, we'll get started. So tonight, our brief overview of what we're going to do is in this evening in our health huddle titled Planning for Your Birth, we're going to learn all about birth plans. We will talk about what a birth plan is and can be, how to make a birth plan, and I'll give some suggestions for items to consider and or to include in your birth plan. So let's dive right in first. So what is a birth plan? So a birth plan can be really whatever you want it to be. There's no right or wrong way to create a birth plan. There's nothing that has to be included in a birth plan. It is whatever works for you and your family and your pregnancy. Even I have some patients who, their birth plans may vary quite differently from one pregnancy to the next. So you certainly can change it up. If you've had a prior pregnancy and used a birth plan in the past, you may want to do things differently. Many pregnant people will like to use it as a wish list for their birth experience. And that's what I usually encourage my patients to think of it as. So think of it as a list of your wishes, your preferences for things you do and don't want to do or have done or be a part of your birth experience. And your birth experience includes what happens before, during, and after labor and the birth of your child or children if you're having twins or triplets. Another way to think about a birth plan is that it's a communication tool. So it can also be a great conversation starter for you and your providers to make sure that anything that you really want to bring up that you make sure is addressed when you come in for your birthing experience, that is addressed. And so it can also be used as sort of an outline or a guide in that regard. I always encourage my patients to think of it just like that, as a guide or a wish list or preferences, but really to try not to hold too strongly to it and to really try not to think of it as a list of instructions or demands or absolutes. Childbirth can be incredibly unpredictable, and your wishes and preferences may even change during labor and birth, and that's okay. I've had patients who have had very strong preferences on their birth plans to say, there's something, like they would never ever want an epidural and they don't want anyone to offer them an epidural. And we'll talk a little bit more about pain management and epidurals in a little bit, but, they would never ever want an epidural. Don't even mention it. And then something changes in that labor experience and they really want an epidural. And in fact, they benefit from it. And that is okay. So, again, the birth plan should just be that and not anything that's too rigid, because things can change. And if you've had a child and you've experienced birth before, you probably already very much know the unpredictability of labor and childbirth. But if you haven't, just get ready for a wild ride. So next, let's talk a little bit about how to make a birth plan. I mentioned earlier that, sometimes it can be different if you've had a birth in the past or you've used a birth plan previously. And so sometimes your birth plan might differ depending on if this is your first pregnancy or if you've had prior experiences to inform how you create your birth plan. Prior experience may help you guide to know what you may or may not want to do differently. It may reinforce things that you were really happy that you included on your birth plan previously. You may realize there were things you really didn't want to include. And then also, things change. You may have different conditions or circumstances surrounding your current pregnancy that might differ quite greatly from your prior pregnancy experience. So before you start working on your birth plan, in addition to doing things like joining this event where you can learn all about birth plans, you want to just learn about childbirth in general so that you can be informed and kind of have an idea of what things you want to include. So there is a wealth of resources out there of how you can learn. As a OBGYN, I always say that your provider, we can be a great resource for you. And we can answer a lot of your questions and give you some guidance about things, that are really important for you to know about your childbirth experience. And particularly, we can give some more individualized advice because we know you and your unique set of health circumstances and your unique pregnancy. But any of you who've been to a prenatal care visit know that they don't last forever, and we can't possibly cover everything that you probably want to learn and need to learn about preparing for childbirth in just your prenatal care visits. So we encourage you to use other resources. There are books out there, and if you've ever gone to Amazon or Google and then search for birthing books or books about childbirth, you get millions of results. It can be so overwhelming. Which book is the best? And I have patients ask me that all the time. Which book is the best? There's not one best book. There's so many different styles of writing and styles of approaches to childbirth. And so, I would encourage you to talk to your individual provider. They may have recommendations that they think would best suit you. And also ask your friends and your family members what they have read or used and that they found to be really beneficial. I find often that there's, someone who knows you personally really well, they often can know what kind of resources and books may work best for you and your family. Classes can also be a great way to learn about childbirth. Many hospitals and health centers offer birthing and even parenting classes, often that are free or very low cost. And, now with the convenience of the internet and doing things like this, you can also attend classes online. So there are a variety of ways that you can learn about childbirth. and have the opportunity to ask questions about the experience. One benefit of doing classes through the hospital or the birthing facility where you plan to deliver is that you can get some specific information about the way things kind of work in the hospital or the birthing facility where you plan to deliver. We'll talk a little bit more about that just here now. So if you're able to, if it's not part of a class or, just separately, I'd encourage you to take a tour of the facility where you plan to give birth. You can do these mostly now in person. Some places still allow them and, offer them virtually if travel or time off of work is a challenge. It can be helpful just for some patients, really, they find it's comforting to see what the birthing rooms look like, to walk the halls, to know where to go check in when it's time, when they go into labor, so that in that potentially, exciting, adrenaline-filled, sometimes stressful moment, you don't have to think about navigating, well, where did I park and what desk do I go to? So just having some of that familiarity. But also in the tour, it can be an educational experience as well. And it's a great time where often the tour guides will talk a little bit about the standard practices in that facility in terms of birth, and also some other just kind of rules or requirements around that facility. Some things that I encourage my patients to think about, ask about, read about are if there are specific policies around visitors. Sometimes those can even change depending on the time of year. We're about to get into respiratory virus season with flu and RSV. And when those pick up, a lot of healthcare facilities have tighter restrictions on who can and can't visit certain units, and particularly childbirthing units are often a little bit more closely restricted because newborns are vulnerable and we don't want our newborn babies getting sick. And so there may be some limitations around who's able to be a visitor in terms of age and or the number of visitors that you can have in your room, and perhaps even the hours of visitation for certain individuals who can come and join and visit you. You also want to ask about standard birth procedures. So there are some things that are very common in many healthcare facilities, things like delayed cord clamping, which means, not clamping and cutting the umbilical cord immediately after birth, delaying that sometimes from anywhere from 30 to 60 seconds. There are a lot of healthcare facilities that practice skin to skin, meaning immediately after birth, instead of taking the baby away to the warmer and wrapping and drying it, they just put the baby on the birthing person's chest. And so that allows for improved bonding between the parent and the infant. Improved temperature regulation for the infant. And so a lot of places have moved to some of these things being more standard practices. You're still always welcome to include things like that on your birth plan, but you may not need to if that's just the standard of care and where you plan to have birth, experience your birth is going to do things like delayed cord clamping or skin to skin. It may be helpful to know if where you plan to deliver is a teaching facility, so like a teaching hospital, where there are trainees like resident physicians, nursing students, anesthesia learners. So that's very common in a lot of healthcare facilities and maybe a part of your birth experience. And it's just helpful to know that so that you are prepared. You're welcome to ask any questions about anything during this tour. And if that person who's giving the tour doesn't know it, they often can direct you to the right person, the right resource to give you that information. So now we'll jump into actually talking about what to include in the birth plan. And it's there in the chat, the template that you can use during this, but I'll also, let's see if my technology wants to work for me to share my screen, and we'll kind of go along together on it here. Great. So I am going to share that there with you all. Okay, so this is our Twill Care example of a birth plan. So we can just kind of walk through it, and we'll talk about a few things that can be really helpful for you to include in your birth plan. Let me see, I'm just going to adjust the size here. Oops, sorry about that. Technology. There we go. All right. So, again, this is just an example, not an absolute requirement. You can just free text it. You don't have to use a form in any way. I'll just, before we get started on this or dive into this deeper, just a reminder, if any of you have to leave early or have other obligations this evening, no worries. We are recording this and it will be available to watch on our YouTube channel a little bit later. So let's just walk through this birth plan and we'll talk a little bit about what to include. Obviously here we have, your name. Pronouns are important to indicate which pronouns you use, how you'd like to be addressed. So, you have your legal name or even your preferred name, but what do you want the healthcare staff to call you, to address you by your first name, by your first and last name, with a particular title, anything like that. Whoever your provider is, your doctor, your midwife's name. Just a reminder that you may not know who that person is going to be for sure, depending on if you go into labor spontaneously. Often there are, a variety of providers who rotate, and it might just depend on who's on call. You can list here the people who you plan to have with you during your delivery, their name and their relationship. It can be helpful here to indicate the type of birth that you have planned. And so often that means, if you're planning for a vaginal birth or if you have a planned cesarean birth, and either of those are perfectly fine and just depend on a variety of factors related to your pregnancy and other medical conditions. We'll talk a little bit more about having a plan B sometimes, which can be important. I really like this form because it has this nice highlighted, blue area that says what's most important to me. Because, as you can see, sometimes this can get a little bit long, and there may not be opportunity to go through all of the elements of the birth plan, depending on the circumstances in which you present for your birth experience. So if you come in and you're in active labor and, there's not a lot of time between you presenting to the facility and delivering your healthy, beautiful baby, then there may not be as much time to go through this versus some of my patients who come in for like a scheduled delivery, whether that's being induced or a planned cesarean birth. There's a little bit more time ahead of time. So I think here, if there's, just some really important things, you can kind of highlight them, star them, list them out here. And then here are a list of other things to think about. So while you're in labor, things you would like. So this can include really anything, how you would like the lighting, if you want it dim, if you prefer it to be quiet, if you'd like to play music that you bring in from home, if you, want to use certain props and certain positioning, just kind of some general things there to include. For pain control, you can list here, what you'd like to have, what you plan. These can be things of sort of, it's not really my first choice, but I'm open to it. I like this language that says I'd prefer not to do or to have, and again, using prefer because it's really hard to have any kind of real absolute sometimes in this. But, if, like I mentioned, my prior patient example, like, I'd really prefer not to have an epidural, for example. So, pain control options can range from, breathing techniques and mindfulness techniques to IV pain medication, massage, hot showers. Some hospitals have nitrous oxide, which is a gas that you can inhale, and then epidurals. Here's a list of just other interventions. So this can be things related to, monitoring, or again, kind of positioning, other, interventions being like maybe breaking your water, if it doesn't break spontaneously, using that medication called Pitocin or oxytocin, which can stimulate contractions. Again, this things that you'd like, where you're open to, and then things you'd prefer not to have. I might sound like a broken record, but I just always remind my patients it's really important just to remember that, to try to be open to all kinds of possibilities, because you may not want to have Pitocin, but you may end up really needing it to move your labor along and to help you achieve that vaginal birth that may be your goal. This highlights specifically delivery preferences. Particularly this one is more geared towards someone who's assuming they're having a vaginal birth. So what would you like while you're delivering? This can be kind of similar to that, what we talked about earlier, like lighting, sounds, which might be different for what you want when you're laboring versus when it's actually time to start pushing. Some patients have preferences about positions they want to be in for pushing, on their back, on their side, using a bar, things like that. Some of my patients really benefit from and like to use a mirror so they can actually see their progress and watch the delivery. And so things like that can be listed here as things you're open to. Or I've definitely had patients where I've offered the mirror and they say, absolutely not. And that is okay too. Things like that, no one's ever going to say, oh, you have to have a mirror for your pushing. That's not that would be okay to say, I absolutely don't want it. That's fine. We have here a list of cesarean preferences, and it's nice to mark either, some patients are planning a cesarean delivery and others are not, but I think it's always good just to have your preferences just in case, because as I've said, childbirth experiences and labor can be really unpredictable. So even if you're not planning it, it's helpful to think through if you end up with a C-section, what you would like in terms of, sometimes you can play music in the operating room. Some hospitals have the option of what's a clear drape. So at the time of the delivery, they can drop the kind of standard drape that keeps the operating field clean and have a clear plastic area where you can see through and actually watch the infant being delivered. You can often still do skin to skin. We do delayed cord clamping a lot in the operating room. So even a lot of those things that some individuals might think are really unique to a vaginal birth experience can also still occur in a cesarean birth. Remembering that your birth plan doesn't just include labor and the moment of birth, but things that are continuing to happen after that. So this is important to think about your baby. And so during your time in the hospital or birthing center, things you have preferences about the baby, remaining skin to skin, rooming in, any kind of medications that you are open to having the baby receive. There are certain medications and vaccinations that are often recommended for newborn infants. If there are any that you'd prefer your infant not receive, you can indicate those here. Some infants, if they are born with a penis, may be eligible for a circumcision, and some parents may choose that for their infant and others don't. It's entirely elective. And so things like that can be helpful to include here in your baby health care. And then thinking about your feeding plans, what you plan to feed, if you're open to, say, if you're planning to provide human milk, but you're open to your baby having formula if needed, or, if you really want your baby to avoid receiving formula, that's okay as well. And then here, just another kind of, summation, other things you want your team to know. So it may not be those very most important things that were in this kind of blue box in the front page, but if there's anything else you just might want to mention, then you can certainly include your notes there. All right, so then I'm going to stop sharing that. But that link is still there in the chat. So now we'll talk a little bit, and I think I see a question a little bit about, what do you do with the birth plan? And thanks for asking that question. That's where we're headed next. So you've written your birth plan. Let's say you've read your books, you've attended this event, you've done your hospital tour, and you've written out your birth plan. So now what do you do with it? Well, it depends on what you want to do, but generally I recommend that my patients, kind of start working on this as they are entering into the third trimester. So around that 28, 30 weeks, although you can start working on it as early as you'd like. And then in that third trimester, bring it into a visit to see your provider during one of your routine prenatal visits. It can be really helpful, even if you kind of give your provider a heads up maybe and say, hey, at the next visit, I'd like to make sure we set aside time to go over my birth plan so that we make sure we have time for that in the visit, because sometimes other things may be planned as part of that visit. So you can bring that birth plan in. If you have any questions, it doesn't have to be a finalized version. You can certainly leave things open, or penciled in, if you will. Ask your provider if they have, thoughts about it, if you're unsure what you want to request. Or again, specifically, as I mentioned, some of those things that might be specific to the facility where you're planning to deliver. Your healthcare provider can highlight some things that, you may have something written down that, again, they may say, well, sure, you can keep that on your birth plan, but we always do, these standard things. So you don't necessarily need to write it out as an explicit request. And it's a great time for you to ask specific questions of your provider and to make sure that the two of you are in a, shared understanding of your birth plan. If at that visit, you feel perfectly confident with it and it's final, you can leave it with them. But sometimes I have patients who I often encourage to say, why don't you take it home, tweak it a little bit, make sure you feel like it's your final version after our conversation today, and then you can bring it back. So again, why it's good to do it a little bit earlier in the third trimester so there's time. I generally then say, can you give me a copy? So I'll put it in your medical record. That way it's in your file, so that it's there when you come into the hospital, or the birthing center. But I'd also recommend that you keep a couple of copies even. So you can have your own copy. Again, it can just, like I mentioned, be a communication tool to remind you these are the things you want to talk to someone about. It can be helpful to give it to the nurse when they check you into your room so that they can keep a copy of it. Some people like to, put it on the wall, or there can be like a whiteboard in the room, just so it's easily visible for anyone who's involved in your care. The version we just showed was, 2 pages, and that is, plenty. I would generally try to avoid making it many, many pages, because it's just going to be hard for your care team to have time to really read through it. And, like I showed in our version, that bright blue box that even highlights, these are the most important things to me. Or if you can, condense it even further to just a short 1-page bullet list, that can be great as well. So just a few other recommendations, on top of that, and kind of trying to keep it simple, keep it easy to read. Sometimes doctors, we're often told we don't have very good handwriting. So, if you're handwriting it, try to write it in a legible, handwriting so that someone can read it. Or if you have access to a computer and you can type it out, that's probably even better. Again, like I said, I'm going to say it a bunch of times, and I'll say it one more time here, is just to remember that it's a set of guidelines or wishes, and try not to think of it as demands or absolutes. The goal is just a healthy, happy birth experience, a healthy, happy birthing person, and a healthy, happy baby. And so sometimes some of those, elements on the birth plan might have to be negotiated or, shifted just a little bit in order to achieve that ultimate goal. Few, if any, deliveries go the way a pregnant person imagined they would, and that's okay. So, really the true power and the importance of this birth plan, I think, is really not in that actual piece of paper and that list of things that you have written down or thought through, but really in the process of creating it, and that thought process that you and your support persons, your family, your provider have gone through to make sure that you have really thought through things that you might experience, that you taken time to learn about the different situations that have arisen, and it can help you prepare for surprises. There may still be surprises that you were not prepared for, and that's okay. But the more informed you are going into the birth, the easier it can often be to even be prepared and to accept when things don't quite go according to plan and little surprises and changes come up. So that's all I have to just chat with about creating a birth plan, kind of what to do with it. Hopefully that was helpful information. So I'm just going to check and see if there are any questions that I can answer. I saw that one question that asked, when you're admitted into the hospital, do you hand it to the care team or more an internal guide to you? Kind of as I said, there's nothing that says you actually have to hand it to anybody. Sometimes there may be something, if you just want to keep it internal, and it might be your own internal mantra for how you feel about things, that's fine too. But I would say the majority of my patients, and I think patients in general, do think of it as a guide for their care team and a communication tool. So they often will hand a copy over, share a copy with their care team. And so sometimes it can be helpful to have more than one copy, just so you can keep one and your nurse can have one in case something happens to it, you have a backup copy. And like I said, also, if you give it to your provider at a prenatal care visit, then it can often get added to your medical record. And so if you happen to show up and you've forgotten it, that's okay too. There's usually a way to access it in your healthcare records. And then I see another question here, some examples of what could be most important to you. Yeah. So, I think it's such a birth is such a unique experience, but I think some things I hear, a lot of are, really like delayed cord clamping is very important to a lot of individuals. That first skin to skin moment is really important. Who cuts the cord? That's a really special moment for a support person, making sure that, that person gets that opportunity. People can feel really strongly about even certain language in the way that they're spoken to, or, words that are used when they're being coached, setting certain environment in the room. Some patients really like to make their own playlist and play their own music. And I actually love when that happens, because, generally it's a great energy in the room. Some patients have a really very energetic and vivacious and, almost kind of loud, exciting birthing experience, especially when it comes time for pushing and they want everyone coaching and cheering. And, it's like a big party. And some patients really feel they do much better in a more serene, calm, quiet environment. And so, I think thinking about some of those things like that can be really helpful in terms of, what are most important to you. Yeah. All right. Well, I think those are all the questions that we have coming in right now, and that's good timing anyways, because we are almost at the end of our half hour. So if you come up with any other questions that you didn't have a chance to put into the chat, or if you're watching this recorded and you think of other questions you have about birth plans, feel free to post them in our community on Twill Care. And like I said, I will try to answer them. And if I'm not able to, some of our other health experts or pregnancy experts can certainly answer your questions as well. So I'd just like to thank everyone again for attending this evening. I hope that you learned some things. And just a reminder to visit Twill Care for more information about birth plans and so much more that we have to share and help you learn about preparing for in your pregnancy experience. Thanks to you all, and I hope you have a great rest of your night. Take care. Bye.